Hi there, everyone. Welcome to another episode of Sunday Speaks. I, as always, am Cheyenne Severin, and today I'm here with.
Abby Boxman.
Nice to meet you, Abby. Today, it's our final week of Substance Misuse Prevention Month. So, do you want to start with just telling us how you got involved with Alumni in Recovery?
Yeah, so quick story. I just recently moved up to Bergen County. It's just about exactly a year. Last year we moved up here, but I've been doing a lot of work throughout the states, for probably the last 11 years. And I got to meet Nancy and joined the parent program to be able to go into the schools and share my story about the loss of my son, Justin. And that kind of, unfortunately, losing him 12 years ago to an overdose has allowed me to, give back, try to do the best that I can to share my story and, reach out to the kids in the schools.
Mm-hmm.
And during this process as well, I went back to school. Took me about 10 years altogether and finally became an LCSW last April 25th, got my license, and here I am. And I do what I do to, give back to everybody within the community that I can help out in any capacity.
Congratulations on
Thank
your.
you.
Mhm. Do you want to talk a little bit more about Justin?
Yeah, that would be great. So I brought in a picture. So here's Justin.
Mhm.
This is Justin. This is actually one of his high school pictures. The other pictures are downstairs hanging on the walls and still in boxes because I haven't unpacked them yet. But
Mhm.
um, Justin was amazing. He is the middle of my three sons. I have three boys, Danny, Justin, and Andrew. And, typical just, kid went to Colts Neck High School. All my boys went to Colts Neck High School. We moved from Staten Island to that area back in 2003 and, moved out of New York figuring, okay, I can do what I can to, keep my kids safe, put them in really good schools. And unfortunately, Justin's, senior year, he fell into some bad habits, of course. At that time, this was like back in the late, 2000s. He graduated in 2008. There was a lot going on. Fentanyl was not even in the picture, but overdosing was, and we really didn't know anything about it. But the prescription drug epidemic was just skyrocketing at that time. And, he did hurt himself in football camp.
Mm.
And I really believe that probably, didn't help the situation and his friends. And, they were high school kids at that time and, doing the thing, partying, having a good time. And I believe that with my family history and genetics, Justin has had that, that significant disease that we call addiction. And it just kind of spiraled from there. He went to college and it really got worse at that point. We were hoping that he would have played football. He was a really great football player. And, things didn't turn out the way that we expected. And as parents, we really didn't know anything. And at that time, it was prevalent, but of course I didn't know anything about it. Here we are, we moved to this nice community and you think everything is all great, but there were a lot of things going on that we just really, you don't know what you don't know.
Mm-hmm.
And you don't really know about it until it hits you in your own backyard. And that's really what happened with Justin. And, really, it happened kind of quick. He, came back from Kutztown University, went to Brookdale Community College, and, did a little stuff here and there. But the addiction started to get worse. And literally, it was really a year that things started getting really bad. And from July 2010 to his passing in July of 2011, is when he first started heroin because of the pills, couldn't get the pills. And that story was just like everybody else's story, unfortunately. due to his passing, I figured, what can I do? I needed to do something. And one day I was coming back. My husband I took a ride with him to work. And at that time he was working in Long Island. And I'm driving and I'm sleeping. And I was laying back in the seat and I got up on the Belt Parkway. And if anybody that's watching or knows the Belt Parkway, it's never any traffic. Okay. So I got up and I see this bus next to me and it said, Rutgers at the Community. And I just looked at that. I looked at him and I said, I'm going back to school. And my husband was like, okay. And I did. I started my journey. But prior to that, I was just grasping for straws, whatever I could do. I didn't, after you lose a child, there's this emptiness and there's this hole that just can never be filled.
Yeah.
So you try to do everything that you possibly can to fill it. So I met some amazing, amazing women, I should say, and men as well, on this journey for the last 12 years and, helping, out, and I can even do shout outs to them. There's Patty, there's Sue, there's I'm getting a little frazzled at the moment, but I have, all these wonderful, amazing moms and dads that have moved mountains to, get the 911 bill passed back in 2013, testifying in front of Jakarta. I went throughout all of, Monmouth County and all throughout the state, sharing my story on Justin and the prescription drug epidemic and what was happening and how our, kids are dying. And, starting to do that, I realized I needed again to do more. So I ended up starting a grief group called GRASP. So I attended the first group of GRASP down in Marlton, New Jersey. A shout out to Christine. And it was a little far from my house. And I said, you know what? I need to do this. I need to help these parents. And that's kind of where my passion led. And I feel all of us that are in recovery, all of us that do something within the world of addiction, I think we just need to find our niche, and there's so many of us, right, that are out there and, sharing their stories on recovery and, helping out and working here and working there. And for me, it's, touching those that have lost someone to addiction. And, I started the GRASP group, at that time, I brought it to Monmouth County, and it was the second one in New Jersey. And I just ran it for 10 years up until right about 2020. And it was wonderful. And sadly, having a place for those that have lost to addiction. And, still to this day, there's still the stigma that's attached to addiction, right? A moral failure of parenting and a moral failure of those that we lose, right? Because, they should have known, and just all the ignorant, the ignorant comments, and I guess, the lack of understanding and people really understanding addiction for what it is. And, I would say, there must have been 1,000 people that came through my group for over those 10 years. And it really made a difference being able to be there and having a safe space for others. For parents, and it wasn't just parents, it was, siblings, it was cousins, it was friends, it was, partners. And, it allowed me the opportunity to figure out what I wanted to do. And after seeing that sign, I said, okay, doing this, going back to school, finish my associates, went to Brookdale through the Community at Rutgers, went to Rutgers, did my bachelor's, did my social work, did my MSW. License, and here I am. And life changed last year, and I moved up here, and I knew Nancy. We were kind of roaming in the same circles, just not quite there. And when I moved up here, I said, okay, what can I do? I'm in Bergen County. I did a lot of work in Monmouth, and I said, you know what? I'm going to reach out to Nancy. And of course, as we all know, Nancy, she's amazing, and all the parents and just everybody. And, she's kind of brought me in and said, okay, help out. And I'm here, and I'm, going to do what I can to share my story as everybody else does, and be able to be there and do what I can, especially, like I said, in any capacity. Maybe I'm rambling, and I am, I'm sorry.
Oh, you're fine.
But yeah, and it's been a journey. It's been a really it's been yeah, to say the least. It's been a journey.
So, just out of curiosity, what did you do before you went back to school?
Well, so I don't want to say nothing. No, my so I was a mom, when my kids were little. So I mean, as we talk about, right, the stigma of addiction, I mean, normal childhood, I stayed home with all my boys because who was going to watch three boys under five? Like nobody. I mean, it
Hmm.
was, they were rough and tough and taking them to games, and I was involved with all their stuff growing up. My husband at that time had a business, and I worked with him, because what was I going to do? It allowed me the flexibility to stay home. I was fortunate enough that I could stay home with the boys,
Hmm.
and giving them everything. And I did a lot of, and then once they were all a little older, of course I full-fledged did real work and just did it's a lot of insurance company, just doing management on a different level, growing businesses and stuff. But and then I did go to college, but I never finished because I got married and popped out three little boys. So life went a little bit of a different way, but it was wonderful. And I know you've been interviewing people, and throughout the month, and of course I notice you do I guess questioning some of the aces, right? And I know I've used that before when I worked in the organizations, and you kind of look at that, and like I look at like Justin, and I look at my boys, and they had a great life. I mean, if he scored two on there the most, that's because I did used to throw things around the house, but not purposely. You
Hmm.
know what I mean? But like you think about these things, and you're like, what, yes, we know, and which is kind of getting into the clinical part, like a lot of our traumas. I mean, right? What do we do? I think, now that I'm actually, I have my own private practice that I just opened up a few months ago, and really being able to be there, especially for those that are in recovery, and, those that want to work on that trauma. So I do trauma work, and being able to, kind of get into a lot of the stuff that was hard, and it's hard to get into that. When you're in recovery, right? What's the first thing first is to, you need to get sober. We need to be in recovery. You need to have at least, I mean, I look at it and I say, okay, if they can get, a year, 2 years under their belt, okay, then we can start working on the other stuff, right? Because that's the stuff that's deep within us. And, it needs to be processed. It needs to be worked through. And, if I can find a way to help those that are willing to go deep and kind of get into the trauma that they've experienced, then that's that's my passion right now.
Hmm.
So being able to help those, and then being able to help those that lost as well, helping those parents that are grieving the loss of their children, the ones that didn't make it, the ones that weren't fortunate enough to be here and to be in recovery. So it's like that, dual. I want to help you stay, and I want to help you get through this. And then I want to help the parents because they need all the support that they can get as well.
Hmm.
So finding my passion to, do what I can for others. Guess what I wasn't able to give Justin, now knowing what I know, if that makes any sense.
Yeah, that makes a lot of sense. On that same like line, is there any advice that you'd give to parents, just in general, like anything to watch out for, or any behaviors that you noticed?
You know, I think parents always, you have to trust your gut. That's the first thing. If you feel that something is off with your kid, something's wrong. I mean, parents know their kids. They know them more than they sometimes that they know themselves. So they suspect. You start seeing little changes. The friends start changing.
Hmm.
The attitude starts changing. They're just not. They starting to dress a little bit differently, a little more quieter, a little more manipulative in a sense, holding things in, and knowing, when I used to speak in the schools, it was, I know parents want to be able to um, respect their children's privacy. And I think that's great, but up to a point. I think if you suspect something is happening, search those bedrooms, search things that are happening, cell phones, Know what's happening in your kid's cell phone, because there are so many, of those, as social media. There's so many different, emojis and just
Hmm.
little acronyms that stand for X, Y, and Z. And parents don't see that, oh yeah, that looks like no, it doesn't. It stands for whatever, a bag of weed or whatever it may be.
Hmm.
So you have to, and I think parents, they, it's not the, it's the, nothing is going to happen to me backyard. And, when you live in these areas, and I saw one of the ones, I think it was Chris, who was from like Alpine, New Jersey. These affluent areas too. People are like, oh, nothing's happening. It's all great. It's all fancy. No, it's happening. It's happening there. It's
Hmm.
happening everywhere. It doesn't matter where you live. It doesn't. Addiction does not discriminate, and it'll find you in the top of the castles. With the Rapunzels, and then it's going to see you underneath the bridges too.
Yeah.
Doesn't, and people have this, no matter how much addiction is out there, and people suffer with, different vices, alcohol, pills, heroin, whatever it may be. It's that's what it is. It's a brain disease.
Hmm.
People should know that. But getting back to the parents, know your kids, search for those things. Sometimes, they say tough love, there's this kind of love, it's everybody's different, and every kid is different, and every person that's going through addiction is different. Some people do great in 12-step programs. Some people don't. Some people do better with, medication assisted treatment. It depends on each person. There's no one fit.
Hmm.
There's no one size fits all, especially with addiction. And parents just need to know that, and they need to be aware, and they need to be vigilant, even more so now, because I mean, we're talking fentanyl, and it's everywhere, and people are dying, and they don't even, right? They don't even know what's happening to them. That, oh, well, I just took a Xanax. Well, first of all, why are you taking a Xanax anyway? I mean, not that that's the case, but, like, you think about that, but that Xanax can be laced with fentanyl, just like something else, maybe. So it's scarier. It's scary, scary, scary out there right now with a lot of these young kids, and they need to know. But parents, and sometimes even where we live, determine, it's not happening in my backyard. Let's close our drapes and not let everybody know what's happening. But it's happening, and it's happening everywhere, and people really need to know that, so we can save our kids, and save our future leaders of our world. And believe me, we need some better ones out there. So not anything.
So we're at 2 minutes till we end off today. So is there anything that you'd just like to say? Any comments, questions, concerns?
Um, I just want to say that, everybody has a journey, and everybody has a place in this world to do something. And I think if you can find it, and you can share your story. All of us have a story, and I think our story makes a difference to somebody in this world. And if we can voice that and find others that'll listen to that, I think, don't hold back. Parents, be vigilant of your kids. Share what you know with them. Share the realities. Don't be afraid, because at the end of the day, people are going to be more afraid. You're going to be more afraid of what long-term outcomes could look like. Your
Hmm.
kid needs help, get mental health. There's a lot of kids, there's a lot going on, COVID, so many effects that are happening in the world, that, we need our mental health providers out there. We need our substance use, programs that are out there. We need people out there. We need peers out there. We need each other. It takes a village. And, I'm out there to move those mountains into those villages with all the other people that are in this. And so this way we can do the best that we can, so we can, save a life and create some healthy outcomes for our children and the rest of the world.
Thank you, Abby. I really enjoyed talking to you today.
Thank you. And I wish you all the best. Thank you. Thank you for this opportunity.
Have a nice day.
Thank you. You too. Take care.